Welcome back. I'm Maggie, one of the hosts of Neighbors Helping Neighbors, the podcast from Father Joe's Villages. This is a continuing series where we explore homelessness, its causes, and solutions to the issue. Our guests include experts and leaders in the space, people with lived experience and unique perspectives on homelessness. To learn more about our mission, visit us at neighbor.org and follow us on social media at Father Joe's. Excuse me. We have a really exciting topic today. It's something that's been coming up in our previous episodes, but we thought it deserved an episode of its own, and that topic is stigma. What it is and how it impacts the folks on the streets who are experiencing homelessness, their health and their well-being, and what we can do about it. I'm really excited for you to meet our guests today. I love having Father Joe's staff on the show because we have truly remarkable people working inside our organization. Joining me today from the Village Health Center are Dr. Sarah Carrera, family and psychiatry physician, and Mark Stevenson, licensed clinical social worker and behavioral health clinician. With me always is my co-host, President and CEO of Father Joe's Villages, Deacon Jim. Welcome.
It's good to have you with us.
Welcome. Thank you for having us. That's right.
No, we've been excited. We've been expecting today's episode. It's an important topic.
Oh, wow, it's a big topic, and I think it's one of the most important ones because it's what people see and they feel when they think about homelessness, exactly. Right? Which is the core of a lot of things that happen in terms of the support we have for our population.
It really is.
We always start with introductions and a little bit about what you do at Father Joe's. If you could start us off, Doctor.
Sure. So as you mentioned, I do family medicine, I do psychiatry. I do mostly psychiatry right now just because there's so much need. And I also do therapy. So I have some long-term therapy patients, and I think that I try to do therapy with people every time they walk through the door, even the first time, because there's so much need and there's so much that people have hidden inside that they're just trying to push back and hide from, that we need to help them through. So I kind of build my practice around that concept of integrating and pulling together all the pieces that people need in whatever moment that they're most needing it as they walk in the door. Beautiful. I've been here for 6.5 years, by the way. Wow. He's been here longer.
Okay, well, I had a unique opportunity when I came to the village. I started out working actually with the residents in the shelters in a mental health case management program. And I've had an opportunity to work so many different jobs within the village that I've really gotten a well-rounded view of what it's like for the folks that are coming through our services and all the different aspects of the services. So I've worked in the residential structures with the folks providing mental health case management. I've done run the drug program that we have, a state-certified outpatient drug program on site. I managed their mental health program for a while before it was integrated into the clinic. I got to do a special project that worked with the highest users of the emergency room, and I was director of their permanent housing services to provide supportive services for people that graduate from the shelter into permanent housing. And from there, I moved back down to the clinic and started doing trauma therapy and working alongside psychiatry to provide ongoing and extra support for the folks that they're working with. And that's where I work with Sarah, because she's sending me people all the time, and we get to communicate on what the best approach is. You
need someone good, you go to Mark.
You're both well known at the village. And how long have you been at the village?
19 years.
Wow, amazing.
Long time. Yeah. So you guys are the subject matter experts.
Yes. In our clinic, I think we actually are.
Mm-hmm. Absolutely, and behavioral health is more and more of an issue that we're finding within the work we do at Father Joe's Villages. You know it better than anyone. I always try to start, or I'd like to start always, just informing our listeners and informing our viewers of the comprehensiveness of our programs. So yes, we have our Village Health Center, our federally qualified Village Health Center. Behavioral health is an important aspect of it. Primary care is as well. Dental care is as well. I always invite people to come and visit our village because we have that wall of smiles, the before and after restorative dentistry, and how important that is, not only as it relates to self-esteem, but as it relates to who's going to get that job, who's going to find that housing. And that's very, very important. Street health. That's been a godsend for those who are on the streets and don't access medicine in a traditional way in brick and mortar, just going out, meeting them where they are, and dispensing medications and health care. And that's psychiatric care as well, right there on the streets as well. That's important also. Then we take care of our children, therapeutic child care. Anywhere from literally newborns up to age 18, through our preschool program, through our after-school programs. It's incredibly important. We know that we don't mitigate their circumstances. They're the future adults who are homeless, and that's not what we want for them. They're four times more apt to be homeless in adulthood if we don't get to their what's ailing them in a sense, right? They're academically, emotionally, socially delayed. So we work with them and with their families as well. Employment, like for most people, that's what leads to income. And so we have vocational training so that we impart the marketable skills that people need in order to be able to go out and be successful. And it's expensive to really live here in San Diego. Some people have multiple jobs as well. And so that's an important element. And then we have shelter beds, right? We have 800 to 900 shelter beds in any given night. And that's an important element in meals that we serve on a yearly basis, breakfast, lunch, and dinner. So we're unique in the space of homelessness because we're so comprehensive and so holistic in our approach, and that's what makes a difference in the lives of individuals. And of course, in the end, what breaks the cycle of homelessness? Truly, a home. And so we have our Turning the Key initiative. We're deploying affordable housing units out there through either the acquisition and refurbishment of motels or the new construction as well. We need more housing here in San Diego. We don't have enough, and in the end, that's what breaks the cycle of homelessness. So that's whirlwind of all our programs across the board. But it's good, so the viewers and the listeners have an appreciation of what we do as a whole, right? So anyway, but today we're going to focus on stigma.
We are. And I can't help but start by sharing something that my great-grandfather used to always say. He was a high school teacher and a coach. And whenever he was out with his family and they would see someone experiencing homelessness or kind of down and out, he would say to his children, one of which was my grandmother, he would say, remember to show them kindness. He could be an old hockey coach. And even though it's kind of silly and we laugh about it in our family, what he was doing in that moment was teaching his children to see the humanity in individuals and that everybody, despite their circumstances, is deserving of kindness and compassion. And that's what we're talking about today, is breaking down that stigma. So let's start with what stigma really is.
I went to the internet and got the dictionary definition.
Yeah. What did you get?
I got two. I got the Webster's and the Oxford. And Webster said a mark of shame or disgrace associated with a person, quality, or circumstance. And the Oxford said a set of negative and often unfair beliefs that a society or group of people have about something.
Mm-hmm. Mm-hmm. So what does that look like for our community?
The people with whom you work, right?
Yeah, so interesting. This was something that came through my email last week, and I immediately sat with one of my longer-term therapy patients, and I said, hey, he was in a good space. I said, just tell me about your experiences, because I have to give this, talk about stigma. And he said, let me tell you. And so I'm going to just read the quote from him, because I thought it was really powerful to have it come through his own words. He said, it's not so much what people say or do as it's what they think about people such as myself. It's a feeling, the way that people look at you, that you're like the scum of the earth, that they're afraid to walk near you. We weren't always like this. None of us were. A lot of us had real jobs we did for years, and for some unforeseen reason, things happened to us. We could never foresee what would happen to us to put us in this position. At one time, I was a soldier. I was a real person. I am still a real person. Personal things happened and devastated and destroyed me. I'm still the same person that my mother raised. I still have those same values.
Wow, powerful.
Yeah.
Mm-hmm. What kinds of misconceptions are you seeing, Mark?
Well, I know in my experience that, there's a lot of labeling going on that I think, follows some of the folks that we serve around. I think stigma in the beginning is like a wall that kind of blocks people's ability to give somebody full social acceptance. It just blocks their ability to see them as a complete human being and leaves them open to just putting all these labels on them. So what do our people look like that have mental health and substance abuse issues that come into our doors? A lot of times they could be really escalated, they could be shouting, all of this kind of stuff. And sometimes people can personalize that or get upset that the normal routine of their daily structure is not being followed, and therefore we must stop whatever it is that's going on and everything. And I know within reason we do have to maintain a certain level of safety and all of that. But a lot of times people, and I usually tell this to the people that I work with, I say, they're not yelling at you, that's the sound of their life squeezing out of them. Because of everything that they went through before they came through our door, including having really bad experiences with other service providers. We need to give them a little bit of a break, and I'm really proud to work at a place that hires special security teams that have a high level of distress tolerance and a huge level of ability to be able to de-escalate folks. And when things get too out of hand and they do have to ask them to leave the clinic, you're not banned from this clinic. You're asked or even escorted out with an invitation to come by tomorrow and try again. And these are the kind of things that we have to do, because folks like we work with are constantly being labeled as non-compliant, aggressive, boisterous, loud, belligerent, rude, all of this kind of stuff. And when people begin to document these kind of things in clients' files, those kind of things follow them around, and it reminds me of some words to a Pink Floyd song. It says, the paper holds their folded faces to the floor, and every day the paper boy brings more. My wife had a program once, and she taught me this about strength-based case management documentation. And she said instead of client failed to follow through with the instructions, they would write, I failed to be able to get the client to be motivated enough to follow through with the instructions. And it would leave them an opportunity to try some other angle or approach to motivate them.
Well, it just shows that the perspective that we come from shifts the outcome. Right, and I think that sometimes when we see certain things, they stick in our brain and we assume and we generalize. I mean, a lot of times we generalize because our brains are made to do that. Our brains are supposed to take in stimulus and try to put it in a category to allow us to understand the world and keep going, to be able to focus on the things in front of us. But the problem is when we see one thing or one person have one experience that could be hard. And I bet all of us in the room are sitting here having had an experience with somebody that was out on the street that wasn't safe, for example, and we knew it wasn't safe. We didn't feel it was safe, and it was a scary / I'm going to stay away kind of moment, that we then have the tendency as human beings to generalize that to others and use that experience that then becomes a judgment around others. And also we take that view that we have of the person in that moment, and because we don't have a lot of other bandwidth, and that's all we have in front of us, we take that to be this is that person and this is the reality for them, versus this person has that one aspect of them, but keeping your mind open to the fact that there are probably a lot of other aspects to that person and things behind it that could have led to that moment being what it was.
It reminds me of something, I think it was our first podcast, we had Tamara Kohler from RTFH on first or second, and she was discussing just that, how our folks that are experiencing homelessness or living out on the street, someone might be having the worst day of their lives, and they don't have any other place to have that breakdown except right there. And thank goodness I wasn't, thank goodness I had my home to have my worst day. You know what I mean? And just having that compassion.
And there was a meta-analysis that was done. There's only one that's been done on homelessness and trauma, PTSD, but it shows that people who live on the streets and who have lived on the streets, 94% of them have PTSD. And so the triggering and the emotional outbursts it makes sense for somebody who has had a lot of trauma, and they can relive that at the smallest thing, and your right brain takes over and the left brain goes down, and it means that you're really just reliving those emotions of the past, and you can act out of that in ways that you wouldn't if you were cognitively present.
And for some, the PTSD may have been one of the reasons that threw them onto the streets, right? There have been other reasons as well. And for others, they may have developed the PTSD on the streets, especially if you've been chronically on the streets, right? So it's just, that one day you mentioned, Maggie, that one day they may be having a really bad day. And yet the reality is that living on the streets, can you imagine? I mean, I've never, thank God, had to cope with that. But I can only imagine how difficult that is. I mean, most of the days, if not all the days, are a challenge in one way or another, right? And it's survival. And that's exactly right. I mean, I admire individuals who are able to really survive that type of an environment, right? And come out of it. And you guys see it on a daily basis, how people do. And you tap into that potential. You tap into that potential, and you restore that hope almost in them, because they've lost hope, and they're able to survive it all.
That's the exact strength-based perspective that we talk about when we want to work with somebody, not only somebody that's homeless, but somebody with mental health problems or substance abuse issues. You can't solve a problem with the same thinking that created it. So we have to find out what are the strengths that some of these folks have that we can begin to build on. And one of the major ones is, God, did you show up to an appointment today? That's a strength. Let's build on that strength. Man, you're out there surviving on a day-to-day basis. You have to duct tape your backpack to your chest at night when you go to sleep to try to make sure it doesn't walk off and be gone by the time you wake up in the morning. Let's talk a little bit about the courage that it takes to do all of that and the strength that it takes to do that. And how can we take some of that courage and maybe accomplish this little task that moves us a little bit closer to housing? So that's exactly the kind of thing that we want to be able to do. I have a client that's severely psychotic, right? And she believes that she can hear God talking to her, and she also believes and becomes very paranoid about the potential that she might be sex trafficked because of things that have happened to her in the past. But for a number of years, none of those things have really happened, but she gets really paranoid. And so instead of trying to find some bona fide solution that makes sense to me, I reached into her psychosis and I said, okay, let's look at how God has protected you over all this time, and let's see how we can apply that knowledge that God is with you to these times that you get really paranoid. And it's working. So we have to have some kind of creative ways to be able to really look at the person themselves and what they're going through and apply interventions that make sense to them.
Yeah. Marcus taught me a lot about that. I watch him and I soak things in as I see him in the hallway.
From each other.
One of the things that I was just thinking about, though, is you were talking about people who are on the streets and how hard that is, and what we see when we're outside is that homelessness doesn't just have one face, right? We see the people who have really just fallen through the cracks of society and everything and become chronically homeless. There's so much to homelessness beyond that. People who are couch surfing and jumping back and forth between friends and family. People who are hiding it with everything that they have, trying to just pretend that it doesn't exist and that they're okay and they can make it scraping by. And frequently that actually prevents people from getting the help that they need to, because they don't want to admit that they are homeless because it comes with the stigma and the judgment of others.
Tell me more about that. Tell me more about the impact that stigma that they're carrying around on top of everything else that they're dealing with impacts their health or prevents them from seeking care.
Mark.
Oh yeah, no problem. We serve countless people that come through our doors that have had a string of very bad experiences of being judged, being cast out, being called, like those labels that I mentioned earlier, non-compliant, resistant, irritable, restless, all of these things that make it hard for them to work with. And a lot of the times, what that is somebody is struggling to be able to follow somebody's established norm of how these services are delivered, instead of trying to build the way that we deliver these services around the client and their reality. So we deal with that all the time. We have clients come in and they are already ready for it not to work because of all the times they've been, judged and shooed out and put to the side and told not to come back by other service providers in the community. So us being able to have patience, us being able to have room for them to escalate a little bit, have a range for them to say, hey, it's okay. I don't know how many times I'll be sitting in my office and I'll have a client in my office and the door is closed and that client will start screaming. Again, that's the sound of their life squeezing out of them. It's not necessarily at me, but they need a safe place to do that. I have people that are in the clinic come into the door, knocking on the door, Mark, are you okay? Hey, we're fine in here, and sometimes I need to let them have room to be able to do that. And when they realize they don't get labeled, judged, or kicked out for all of that kind of stuff, they begin to calm down. They begin to get into a better place to be able to, participate in some of the other interventions we're able to do to help their lives.
I love that.
Yeah. I had a woman this morning who walked in and she said, I didn't want to see anybody, but my friend really said I had to see somebody. And she said, and I asked, who should I see? And they said, I should see you because you've been here longer and that you'd be good. But she said, I walked into your room and she's like, wow, I have a forest in my room. And I love it. I have lots of plants. And she's like, wow, okay. And she said, I've had really bad experiences with the medical profession. She said, thank you for not judging me. Thank you for allowing for me to be me and not feel pressured. And she said, I just feel comfortable and safe here. She said, I want to come back. Mm-hmm. And it was just that recognition that we do something special where we are in helping people feel safe and comfortable, and we don't judge, and we do have space for people. And it's not always an outburst. Sometimes it's just giving people space to say, I'm not going to push you to do anything you don't want to do. I'm going to let you be who you are and have the experiences you've had, and I'm going to listen to you, and I'm going to allow for you to decide what the next step is. I'll give you options, and I say to people, I'm here to give you tools, and you're the one that decides what you want to use. I'll just give you the information that I have, and I'll walk beside you. Even if you decide not to have treatment, because some people decide they don't want anything except to come and talk to me. And I said, okay, well, that's fine.
Well, the concept of walking beside another, isn't that great? You journey with them. You journey with them. I'd like to say that we journey with individuals as they journey out of homelessness, right? I mean, and that's an important element, just meeting them where they are, right? And so, what are the biases that you find in individuals as it relates to those who we serve? What are those biases? And we all have biases, obviously, as it relates to a lot of things. But when it comes to those who we're blessed to serve, right? Those who are on the streets or unhoused, what are the biases with which they contend, actually?
I found some. Should we play fact or fiction?
Yeah.
Yes.
Yeah.
Okay.
I love it.
Most are mentally ill.
True or
I've heard
false?
that one.
True or false?
Yes.
Right.
Yeah. What do you think about that?
I don't think that should be something that you would use even if it was true.
Right.
Because that's labeling and stigmatizing, right?
And yet, if we were to address that with individuals, yes, we can address it by saying, maybe that's not how we should use that term or that we should be using that term. The reality is that most of the individuals don't have mental health challenges, right? And so, but people think, and as a result, it creates a bias against, right? So they think that, to your prior point, doctor, that they think that then categorize everybody as having mental health issues because they've encountered a few who have.
Well, and I think a lot of people who aren't homeless, right, have mental challenges, right? We all have emotional challenges, and I think that, I've had therapy in my life. How many people do I know that have had therapy or going to get therapy because now it's less stigmatized than it used to be? And at what point do you call it a mental illness because you have emotions that are hard, right? If you're in a situation in your life where you've had hard things happen to you, you're gonna have a lot of emotion based on that, and you're gonna have needs that go beyond just a clinician that can give you a pill that is for blood pressure or diabetes. But I don't think that makes it something that could be said, oh, they all have mental illness, versus like, hey, we're humans and we all have emotional needs, and it's figuring out what that is and making sure that we're treating it.
And yet we know that some are psychotic, like you mentioned, yes. Mark. But that doesn't mean they're all psychotic, all right? And that's why I mentioned that, right? Again, it's not only labeling, but it's then applying that across the board to an entire category. So that's one.
Some of the others that came up were the majority abuse drugs and alcohol, they're dangerous and violent, they're criminals, bad choices led to their homelessness, they spend all their money on drugs, or they just need to get a job.
Right.
Need to get a job. The reality is that most people with whom we work have jobs, right? Some of them, in fact, have 2 and 3 jobs. It's extremely important to live here, right? And then if you're only making minimum wage, and you have a family, I mean, so it's difficult. So it's not a matter, so in that situation, it's a matter, how can we help individuals in order to really succeed at their jobs, or they have promotional opportunities and like whatever that is. So it's not a matter that they're lazy or they don't have jobs, right? But how can we maximize that experience for them so that they can be as successful and self-sufficient as possible?
Yeah, most folks probably don't know the distance between the sidewalk and this job type of thing sometimes. There's a distance there that really, it makes it really hard for somebody to just jump from there without the right kind of help and support. And if we have too many things levied against them or too many labels pushing them back down, then they aren't going to be able to make that jump, without our help. So, all of the services and things that we have, I know from my experience here at the Village that, and other places that I've worked, that untrained staff tend to enforce rules. And then trained staff are able to be better at looking at different angles and approaches and ways of saying things to be able to reach people. And I know that we do a pretty good job, especially, I've noticed in the clinic too, but we do a pretty good job at Father Joe's Villages of hiring people that really want to work with this population and really want to reach them. And they know the value of creating that relationship, being an anchor for a lot of these folks, because a lot of times I have people coming in that, there's a lot of other things we probably need to work on and get to, and therapy that I think they should have and all of that kind of stuff. But what they really need right now is to feel like a human being when they walk out my door when we're done. And they need to feel like they have an anchor in this place, because when they walk outside sometimes they're just involved in that chaos until the next visit they come back at.
Tell me more about some of the practices on the Father Joe's Villages campus that combat stigma. You referenced the security guards that have additional training, hiring staff who have lived experience or who have special training.
It reminds me of one of the security guards one time. There was somebody that lives on the streets, and we all knew him. His name was Mo. God rest his soul. But he was sleeping under the stairwell. Nobody's supposed to be under the stairwell. And the security guard went over to wake him up, tapping on his toes and things like that, his boots. And Mo was waking up, and he was getting really mad, and he was cussing and yelling and doing all of this stuff. And the security guard just said, Mo, I can't go. I got to get you up. I got to get you out of here. And he yelled and spit and got angry a little bit more. And he said, Mo, I'm waiting for you. I'm just waiting for you to show up here with me so we can go and get this done. And so Mo finally realized that this guy didn't want to hurt him, and he said, well, can I get a good morning kiss? And he got up and he walked away with them, and what we need to do is not be freaked out about people's reactions, because we don't know all of where those reactions are come from. Mm-hmm. Something we say, do, or exhibit, might remind them of a way that they've been hurt in the past, and they have to get past that. Mm-hmm. We have to give them room to feel that, okay, look, they're not running away. They're not pushing me out. They're not labeling me. They're not doing all of this stuff until they finally trust us. Sometimes that can take quite a while.
Mm-hmm. Well, what comes to my mind with that story is a great story. And it's not so much that the security guard was going to give him an actual kiss, or that Mo was actually expecting a kiss, but it's more so, it points to connection, mm-hmm. right? That we all need to feel connected. And he needed to feel connected, right? And Mo allowed that connection, because they made that connection. Again, it wasn't through an actual kiss. It was but
you got from anger to humor.
Right, because of a connection. Mm-hmm. All right, we're all, we're not meant to be lone people, right? And we're meant to be communal people. I mean, I think that's within our DNA, and I think that's an example of that. I think once he felt that connection with Mo, if only for that moment, right? It made a difference, right? Yeah.
I want to get back to the question that you asked earlier about what people experience and how they incorporate that and how that affects their mental health. Because I have a story right before this reach out happened, just the week before, I had a patient who had come in, and she had said to me at some point in there, because we were talking about her really significant depression, and she said, yeah, when I became homeless, my ability to believe in myself and my sense of my own worth just tanked. So I reached back out to her, and I finally got in touch with her this morning, and I said, I'd like to know a little bit more. Is it okay if you tell me more? And I want to be able to share your voice. And so I'd like to tell her story real quickly, if that's okay. Please. Okay. This is someone she's early 30s, and she said, she was actually telling me in her appointment that week, she was telling me how she had just always wanted to be a princess, like a real live princess. That was her dream growing up until mid-teenager. She really thought she was going to be a princess. And she then had gotten out, and she got a job, and she had a career. Her mom committed suicide about a decade ago. And she had that change a lot in her life. And then she ended up she was working 3 jobs and trying to make it, because her significant other had lost their job. And so pricing was so high for things. She was literally almost not sleeping to try and make ends meet to keep them in a motel. And then her significant other got gotten into meth. And she said, no, you just needed to stay awake. That's it. And finally she decided to try it, because she was so tired. She just wanted to stay awake. And she'd had ADHD, and she'd been on Adderall earlier in her life. And she said, my personality isn't to have addictions. She's like, so I wasn't really worried about it. I just thought it would help me to be functional, because then I could not lose what I already had. And so she started using, and right after that, she got pretty sick. But she said, my brain was affected first, and so I went into the hospital just to tell them how sick I was, but I thought there were bugs all over me. And so they saw me, and they realized I was on meth, and they just kicked me out, and they didn't address my illness. She said, so I ended up had to go back to the ED a couple more times, and finally they realized that I had a kidney infection, but they had kept me in the hallway outside. And they didn't, I was so weak I could hardly get up, but they wouldn't help me go to the bathroom, and they wouldn't do anything for me, and yet the person in the bed next to me was getting all kinds of treatment and accommodations made for them, and the help and she said it just was so hard for me to see, and I had such great anxiety. And I ended up just quitting my job. My anxiety took over, and I just couldn't keep it all together anymore, on top of having lost so much time out of work because she was so sick and no one was addressing it. And she said, I didn't think I'd actually ever be homeless. I didn't think that was a possibility. And then all of a sudden she was. And she was on the streets. And I'll read a quick quote, or just a couple of things that she said, her experiences of being homeless and on the streets. She said people knew that I was homeless because, I had bags of things, and so there was no hiding that. And because they stood out. They also had the 3 animals with them that they had from before, which were their family, and they weren't going to get rid of them. They had people tell her that she shouldn't have her animals. She had people follow her in the stores and acted like she was going to steal something. She said, I would never steal anything. That's not who I am. And the worst was when they took her dog away. She had gotten arrested for illegal lodging, basically just camping on the streets. And then the animals were taken, and she didn't have the money to get her 19-year-old dog back out. And they put him down. And it was just devastating for her. And she said, I just lost my sense of capacity to be okay in me. I didn't think that I was worth anything anymore. People just acted so differently, and I was lost.
The loss of control. I mean, total
Loss
control.
of so many things.
So many things, yeah. Yeah.
And the stigma kind of perpetuating it and further marginalizing her.
Yeah. And then getting more and more into the addiction that she then had, right, as a result, right?
Right.
Just a spiral. Yeah.
Right.
Trying to come back from that now. We're working on that actively.
And that's the result. That's the result of stigma, right? I mean, we think about it. That's a perfect example in just the way you laid it out and what had happened to her. One thing led to another, and the why. But a lot of it had to relate to how she was being viewed and how she was stigmatized. And so the result is that it is a spiral. It just gets worse and worse and worse.
And I wonder if somebody had reached out in the hospital and been able to wrap around her and say, hey, all this is happening in your life. How do we help cut it off now? How do we help support you to get yourself to a better space? How do we help you with resources, instead of marginalizing her more to where she didn't have any internal
I'm happy
resources?
that you're in her life at this point. And I'm hoping, I'll pray for her. I'm hoping that it'll
Me
make a
too.
difference and you can help to lift her up, right?
We're working on it.
Yeah.
So what can we do as a community, as individuals, to do better, to recognize the stigmas and do better for our neighbors?
For the community at large, I would kind of challenge and ask you to ask yourself some questions. Like when you're driving down the street and you see folks that have their bags and stuff around them and maybe trash that they didn't have any place to throw away yet, what goes through your mind? I mean, do you say, wow, look at that person. They probably have been through an awful lot to get where they're at, and look what they're doing with almost no resources at all. They're surviving and thriving on a day-to-day basis. That's probably not what goes through many people's heads, but sometimes we might have to challenge what automatically goes through our heads about the folks that we're seeing outside there, like what happened to them before they got there. This is somebody's father, somebody's sister, somebody's mother, somebody's son. What happened? Where did the love run out in their life? What broke that ended up them being down this path? And why are they all by themselves in that little spot right there? Or when I see a group of them huddled together, how do I identify in my mind that they're actually probably trying to sleep together to protect each other at night instead of thinking, oh my God, there they go, making the place look ugly again. Challenge your automatic thoughts about what it is that you're seeing here, so that you can begin to see a more human side of yourself, to look at the more human side of them.
Yes.
That's excellent, Mark.
That's excellent.
Yeah, absolutely.
What do you think, Dr. Sarah?
I think there's so many ways we could probably help. I think what Mark said is right. We have to question our thoughts and be paying attention to how we quickly judge. Out of fear, I think we judge out of not wanting to believe that we're part of that we could be part of that. We separate ourselves and we disconnect, where in the end we're all so incredibly connected. And if any of us had some of the things happen that our patients have had happen, we might be in the same situation. And recognizing that we are all in this together and trying to bring ourselves to where we can all feel that and try to help support each other in walking this journey together as humans and community members.
There, but for the grace of God, go I. right? If you think about it, you never know. And we see it because we see doctors and engineers and lawyers and so many others who have been professional, have had professional careers, and they come across our threshold no longer in those careers for the various circumstances, right? And when you get to know them and you realize, oh my gosh, what's happened in these lives, right? And it always, the up before the grace of God go, you never know what can happen. Circumstances do happen, not in economic and otherwise, right? So, yeah.
I have clients that I see that have a PhD and master's degrees and things like that. We don't know when somebody's mental health is going to cause them to unravel or backtrack or cause problems in their lives that end them down that slide that leads to where we're at here today, you know. And they need just as much help as anyone.
Yeah, sometimes people have a diagnosis of cancer for themselves or their loved one, and they end up having to let everything fall apart to be able to stay and take care of that person because that's their rock, right? I mean, there's so many reasons that people's lives fall apart without having any indication that it's going to happen, and then trying to put it back together. It's an upward battle.
So it must be a good feeling on your parts as you work with individuals and you see them progress, as you journey with them, as you mentioned. And that must be a really good feeling.
It is a great feeling, but on the same side of that too, we also in a lot of areas want to see more, like taking a look at program design. There's certain things that we are built to be able to do there at the clinic, and we try to go above and beyond and do what we can. Street health is a way that we're reaching out farther into the community to do more than we were doing before. It's amazing. But I have a particular client here right now that is immobile. She has an electric wheelchair. The electric wheelchair is broken. She's in her apartment, not able to clean her apartment. So the system, the voucher she's in, has put her in abatement for not keeping the apartment up to standards, but she has no way herself to take care of it. Her mental health is so bad, she's, it's very difficult sometimes for her to get along with people working with her and things like that. And so she's had trouble being able to get in-home supportive services in there to help. So we're looking at somebody that potentially could fall backwards out of housing because there isn't something designed that can help her in a more intense way that she really needs versus just more of a standard design of case management or something like that. So we always need to look at the program design to try to understand what can we do more? How can we make sure that I'm not being clinically hindered to the point where I'm just deciding what I can't do versus trying to find ways of doing what I can.
Mm-hmm.
That's excellent. And that's where we advocate, right? Because when we see those experiences, that's when we try to get funding that addresses situations like that. Because the reality is that a lot of the funding, it's almost a cookie cutter approach. And individuals are unique in their circumstances, right? And you can't just apply one level of care. Reality is that there's a lot of care that's needed out there. And so how do we find those resources for them? And if they exist, we need to find those resources. If they don't exist, well, how can we advocate in order to get additional resources?
Mm-hmm. And from a more mechanical level, we're a village, right? And I learned a long time ago that as a village, there's certain things we can do together. So one of the things that happened in this particular woman's case is I reached out to Street Health, who reached out to the client. And then we reached out to the case management program that was in that building. And we gathered people together and kind of formed a team, even though it wasn't part of anybody's program. It was kind of a little outside of it, to be able to try to come in there and make sure this person doesn't go backwards. Mm-hmm. And sometimes we have to serve a need before the program is built or the funding is secured or anything like that, because we're trying to change, end homelessness one life at a time here. And so that's the one life in that moment.
Right. You mentioned an interesting aspect of us, and I alluded to this at the beginning, and that's the comprehensiveness of our programs. The fact that you can form a team of that nature, pulling from different areas of our campus and our organization in order to make a difference, right? That's great. So whether they be resources from the health center or from the employment, case management, residential, as you mentioned, across the board to truly then make a difference. That's great.
When I was doing Project 25, I used everything from security to facilities to the residential. Everybody in the village was involved in Project 25 to make that program work. And it made us a very unique agency to be able to do things that probably no other agency would ever be able to do. Mm-hmm. Yet in spite of that, instead of continuing to fund that particular project with this agency that could do so much more than other people, it took a different direction. Mm-hmm.
It's really
and that kind of thing happens.
It's wonderful to see this village at work. Definitely something to see. And actually, I would also recommend volunteering as a way of educating yourself and breaking stigma, because
Having conversations with people who are actually homeless. And that was one of the things that one of my patients suggested. He said, I wish that people got to talk to real people who are homeless and really ask them about their experiences in their lives to get a better sense of what that feels like, what that's been like for them, and really connect with the humanity. He's like, they'd learned so much.
yeah.
And I love that this is a way to do that.
Yeah.
That's exactly right. Well, getting that perspective is so important. So that it's not being done unto them, but it's, what is it? What are the needs out there? How do they feel about it? We have someone with lived experience on our board as an example, and that's an important element, right? So that we can get that person's perspective. That's absolutely important. We have people with lived experience on our team, and that's so very, very critical.
And on the boards within our teams,
Yes, right. That's right. That's exactly right.
Well, this has been a wonderful conversation. Thank you all so much for being here.
Yeah, this has been great.
Thanks for letting
We're going to
us have a
invite you
voice.
back. We have to.
Well,
we have to
you
talk
have
some more.
Yeah, we're gonna have to pick your brain a little more.
Yeah, I mean, you mentioned Project 25, and that can be a segment unto itself. And so and I know you were so intimately involved in that program, and it made such a difference in the lives of individuals, and it took a village, and that's an important element as well. So we're going to invite you back.
Thank you,
You guys are
Deacon.
great. Thanks for all you do.
Thank you
God
both.
bless you.
All right.
And thank you for joining in the conversation. We've been a beacon of hope for 75 years, and we're not only a service provider, we're a movement and a catalyst for change. The face of homelessness is changing, and Father Joe's Villages is adapting to meet the moment. If you'd like to learn more about our mission, visit us at neighbor.org. We'll see you on the next one. How will you get involved? Join us and take action for our neighbors in need. Father Joe's Villages is rebuilding lives, and you can make a difference. Whether it's through cash donations, volunteering your time, contributing home goods or clothing, shopping at our thrift stores or online, or participating in planned giving, there are numerous ways to get involved. Take action today at neighbor.org, because together we are all neighbors helping neighbors.